You are not broken, and you are not alone. Self-pleasure is common, and for most healthy men, it's perfectly normal. The long-term difference for erection quality, energy, and confidence isn't the act itself. It's what happens in the few minutes after. Small choices in that window either help your system reset or quietly work against it. Here are 5 aftercare mistakes I see most often, what your body is doing in that moment, and what the research suggests you do instead. Hi, I'm Dr. Eva, urologist and men's health expert. Now, let's get into the 5 common mistakes. First, collapsing into shame or rumination. When you sit and stew in guilt, you keep your stress system switched on. Laboratory studies of ruminative thinking have shown higher cortisol and poorer next-day stress profiles in men who ruminate compared with those who don't. Brief skills like slow breathing or mindfulness have been tested in small skills-based trials and have reduced sexual anxiety while improving satisfaction. Classic expressive writing work from the late 1990s by Penny Baker and colleagues showed lower physiological stress responses after short writing sessions. Translation: stand up, sip water, take 10 slow nasal breaths with a longer exhale, or jot a few lines in a notebook. 2 minutes of downshifting beats a 20-minute shame spiral. Second, stacking back-to-back sessions. After orgasm, a short refractory window is normal. Human studies have documented a post-orgasm rise in prolactin and temporary changes in sensitivity. For example, research in biological psychology in 2006 reported a significantly larger prolactin rise after intercourse than after masturbation, consistent with a brief recovery phase. If you chase repeats while tissues are irritated, you're more likely to feel numb or sore, and men who are prone to pelvic floor or prostate symptoms can experience flare-ups. Give yourself a recovery window if you feel sore or switched off. At the same time, don't fear lifetime frequency. A large cohort analysis in JAMA in 2004 and an updated analysis in European Urology in 2016 both found that men with higher monthly ejaculation frequency had a lower long-term risk of prostate cancer. The message? Avoid rapid repeats when you feel irritated, but don't fear healthy overall frequency. Third, shocking your system with an ice-cold shower. Cold exposure can be great in the right context, but immediately after climax, your body is sitting in a relaxed parasympathetic state with blood vessels more open. The classic cold presser literature, dating back to Hines and Brown in the 1930s, and confirmed repeatedly since, shows that sudden cold spikes sympathetic tone, tightens vessels, and raises blood pressure. If performance anxiety or pelvic guarding is part of your picture, that's the opposite of what you want. Rinse with warm water and practice slow breathing right after. Save the all-out cold for another time of day. Fourth, reaching for alcohol, cigarettes, or ultra-processed snacks. Smoking and heavy alcohol use are consistently linked with worse erectile function in population studies. The Massachusetts Male Aging Study and the Boston Area Community Health Survey both associated tobacco and vascular risk factors with erectile difficulties. Vascular studies have shown that nicotine and alcohol acutely impair endothelial function and nitric oxide signaling. Sleep is a pillar here too. A controlled study in JAMA in 2011 by Leprolt and Van Cotter found that 1 week of about 5 hours of sleep per night lowered daytime testosterone by roughly 10 to 15% in healthy young men. Observational work in older men links better sleep with higher morning levels. Right after isn't the time for beer and chips. Choose water, a piece of fruit, a handful of nuts, or yogurt, and protect your sleep window so hormones and circulation cooperate tomorrow. Fifth, ignoring pelvic floor and skin basics. Rough friction without lubrication, harsh soaps, or collapsing into bed in sweaty clothing can irritate skin and the urethral opening. Rinse gently with lukewarm water, pat dry, and if you're prone to chafing, use a small amount of bland, fragrance-free moisturizer on intact skin. On the muscle side, many men hold tension without realizing it. A minute of slow nasal breathing while letting the lower abdomen soften helps the pelvic floor drop rather than stay clenched. When strengthening is actually needed, targeted training works. A randomized controlled trial in BJU International in 2005 by Dory and colleagues showed that a structured pelvic floor program improved erectile function in men with erectile difficulties. If you have pain, pressure, burning, or urinary symptoms, get individualized guidance rather than guessing. A quick reality check, so this guidance makes sense. After orgasm, oxytocin and prolactin rise. A refractory period is normal and varies widely. Sensitivity temporarily changes. None of that destroys testosterone. What helps most is simple: hydrate, breathe slowly, avoid sudden stressors, fuel sensibly, protect sleep, and give tissues and your pelvic floor a little space to recover. See a clinician if you notice persistent pain with ejaculation, blood in semen or urine, burning that doesn't resolve, pelvic or perianal pain, fever, ongoing urinary urgency, a new penile curve, or erections that have been frequently unreliable for months. We'll look at blood pressure, glucose or hemoglobin A1C, lipids, sleep apnea risk, medication effects, mood, pelvic floor tension, and when appropriate, a morning testosterone level. A quick note on 2 natural supports I genuinely recommend. You can find links to both in the comments. First, organic watermelon extract rich in L-citrulline. In a 2011 study published in Urology, men with mild erectile difficulties who took L-citrulline saw modest but meaningful improvements in erection hardness. That makes physiologic sense. L-citrulline feeds the nitric oxide pathway, helping blood vessels relax and support healthy blood flow. Second, an advanced performance blend that combines Acarian, Tomcat ollie, fenugreek, nettle root, and citrulline. A 2013 randomized trial in phytotherapy research found that Tomcat ollie improved stress hormones and self-reported sexual well-being in men with low normal status. Fenugreek trials in 2011 and 2016 reported better sexual desire and, in some men, favorable shifts in androgen-related symptoms. Acarian shows phosphodiesterase type 5, like activity in preclinical work, and nettle is commonly studied for urinary comfort in benign prostate enlargement. Taken together, this blend aims to support circulation, stamina, testosterone signaling, and prostate comfort. These are additions, not replacements, for sleep, training, nutrition, and any medical care you need. Check them out if you're looking for that extra boost. Understanding the bigger picture. Sexual health isn't just about performance. It's a window into your overall well-being. The cardiovascular system that supports erections is the same one that keeps your heart healthy. The hormones that drive libido influence your mood, energy, and metabolic health. When you prioritize simple recovery habits after self-pleasure, you're not just protecting sexual function. You're investing in longevity, mental clarity, and quality of life. Small, consistent choices compound over time. Treat your body with respect in these vulnerable moments, and it will reward you with resilience, confidence, and vitality for years to come. Your health is worth the attention. Thank you for watching. See you soon.